Don't mind this, okay? So in today's video, I just want to show you how to present your seminar because I'm tired of seeing rubbish, okay? So pay attention. This is the seminar that I gave during the public health conference that we just had, okay, today. So I think it will help you to be able to present yours. So pay attention to how I'm going to do it. Good day, my colleagues. Good day, everyone. My name is Dr. Etin, and I'm here to present our research on awareness and utilization of mobile health applications for disease prevention, self-care management among public health and nursing undergraduate students in Abia State University. Now, mobile tech, the advent of mobile tech has brought about transformative changes in healthcare delivery, especially through mobile health applications, which are software tools used on smartphone or smart devices to support various health-related functions. And these apps have gained so much popularity among the young adult population who are now digital natives. You will hear when they say Gen Z know this and all that. So it's during their era. And in Nigeria, where healthcare infrastructure is often inadequate, these health apps go a long way to bridge to improve health and well-being in our society. So we've discovered that there was limited research on how Nigerian undergraduates actually engage with these digital tools, knowing that they are going to be our future health professionals. Therefore, the aim of the study was to investigate the awareness and utilization of these health apps among this study population. The methodology used for the study design was a cross-sectional, descriptive cross-sectional study with a study area in the departments of public health and nursing sciences, with a total population of 2,567 undergraduates. For the sample size, we used Solving's formula to get about 350 students. For the sampling technique, we used a multi-stage sampling to pick the sample, and for the instrument we used a structured and well-validated self-administered questionnaire. Data analysis was done using SPSS version 23, and ethical considerations were gotten from the university. Now, for the demographic characteristics, most of the students were in public health with about 54%, and the other was nursing sciences. For their socio-economic characteristics, most of the students fell within the age bracket of 18 to 24 years. Majority were female, were single, were Igbos and Christians, and had a monthly income of 11,000 to 50,000 naira. This reflects a youthful and largely female student population. For the type of mobile devices used by the students, most of them utilized a smartphone, where few had tablets and smart watches. For the level of awareness of mobile health applications, most of the students, about 88% of them, had heard about health apps, were aware of health apps. However, there was moderate utilization where about 66% of the students utilized these health applications. For the actual health applications used, we saw that menstrual tracking apps and fitness tracking apps were the most were the apps that were most aware of. But for utilization, the same menstrual tracking apps and fitness exercise tracking apps were also the most utilized apps. This is not surprising considering the demographic characteristics of the population, where they are majorly females. However, what was concerning was the utilization rate of mental health applications, stress management apps. Okay, for students that undergo a lot of psychological stress, it was surprising that they don't utilize these apps to manage their stress in school. For the frequency of usage of these health apps, most of them utilized it few times in a month, and duration of usage showed that most of them just started using the health apps within the less than 6 months ago, while the others had about 6 to 12 months. So it shows recent adoption of these apps. For the distribution of students according to the reasons for inconsistency in mHealth usage, you can see that network problem was the reason most of them gave for not utilizing it consistently, and some said there was no time. Then reasons for actually using the apps included tracking physical activity as well as recording menstrual cycle as the most reason given. Now, for non-usage, for those that don't use mHealth apps at all, most of them said that they are not aware. They lacked awareness about the mHealth applications, and some others said that they were not interested, and some lacked the time to explore and utilize these mHealth apps. Now, for the factors that influence the use of these apps among the study population, we found out that age had a role to play, whereby older students were more likely to use the apps. Also, sex, females, of course, were also more likely to use the apps, as we have seen in the study. For monthly income, those with higher allowance are more likely to use the app. Of course, you know that these mobile health applications have to do with using smart devices, which you know that it's kind of pricey in the market. The department, public health students, were more likely to use the app as they are more into the health promotion and disease prevention than nursing students. And academic level, those in the higher level were more likely to engage with these health applications, maybe because they have been taught or have been introduced into to use this application. For barriers that inhibit the use of mHealth applications, and we see technical issues as a problem, and privacy concerns as well as a problem. We also have frequent app crashes when utilizing this app. Now, for discussion, we found out that the high level of awareness in our study actually collaborates with other study findings in Ghana, Bangladesh, and Ethiopia, where also awareness was also high, exceeding 80%. Predominant use of menstrual and fitness tracking apps, especially among the female population, corresponds to global trends where women health and fitness applications dominate downloads. Also, the limited awareness of mental health apps is really concerning, as psychological stress is experienced by university students globally. Of course, the influence of income and academic level suggests that there is digital inclusion and socioeconomic status play major roles in mHealth engagement. Similar barriers, including poor internet connectivity and privacy concerns, have also been documented across low and middle income countries like our dear country, Nigeria. So therefore, the study, we conclude that the participants show strong awareness and moderate utilization of mHealth apps among the study population. So by improving usability and trust, mHealth can have a major role, plays a key role in student wellness and the future healthcare practices of the student population. Therefore, we recommend that these apps that are integrated into the curricula integrate digital health education, because that's where we are moving to. We have AI now assisting in that, so it also play a role if these things are introduced into their curricula, and also encourage collaboration with app developers, so they are not just creating apps because they want to create apps, but create apps that meet needs of the population, global population, a specific population, and also enhance digital infrastructure in university. University should have free Wi-Fi for students to be able to utilize this app. And also, we recommend that we promote underutilized apps, especially when it comes to mental health and stress management apps, that students should be made more aware of it, and so that they can utilize it. And of course, we support longitudinal research on the impact of these mHealth apps on the actual student health outcomes. So thank you so much for listening, and I'm open to any questions that you may have. So that's all for today's video. I hope you enjoyed it. That is how to present your seminar, and the only thing I didn't do is that I didn't add pictures to my slides, but I used PowerPoint to create that. And of course, the conference, they gave us templates to use, that orange thing that you saw there, but I imputed all that. So make sure you are using your animations, you are using transitions, and you're putting your pictures and references and making everything come together. If you want to know more about arranging your slides this way, you can go ahead to get my book on seminar presentation for students. I could not record it, but from today's conference. I was really applauded for it. So if you want that, just click the link in my bio below or the description box below, and see you in my next video. Bye.